So the two types of breast implants are silicone and saline. And there are a few differences between the two, and typically those are what influences whether you'll choose saline versus silicone or vice versa. So the first topic is which one feels and looks more like natural breast tissue. If you have a lot of breast tissue to start, they both look and feel pretty similar and look great. If you don't have a lot of breast tissue and you're adding volume, the silicone does tend to look more like a natural breast and feel more like natural breast tissue. The saline ones feel a little more like liquid in a bag, which is what it is if there's no breast tissue over it or very little. So that's one factor. Another one is rippling. So any breast implant, when it's in the body, like it's going to, change how it's sitting based on if you're sitting up or laying down. And in certain positions, they can show visible rippling if you don't have a lot of tissue over it. That tends to be more visible or more common with saline implants and silicone. Another consideration is what happens if there's a leak or a rupture in one of the implants. So with saline implants, if one of them leaks, your body just absorbs that fluid, and so you notice that breast deflating over time, and sometimes it can feel like it happened overnight because it may have started leaking earlier, but by the time you notice it, it's the next morning and it's completely deflated. The silicone ones, on the other hand, if you have a leak or a rupture, they don't really cause symptoms, they don't cause pain or any even visible changes. So the FDA recommends that all women with silicone implants should get an MRI every 2 or 3 years just to make sure there's no silent leak. And it's called silent because there doesn't really alert you that there's a leak present or a rupture or any problem with the implant itself.